All right, ladies, we're good to go.
Good afternoon. Before we get started today, if you will please make sure that your device, whether it's your mobile device or your laptop or desktop computer, if you will make sure that it is muted so that we won't be distracted by any background noises, we would certainly appreciate that. So I hope that everyone has had an opportunity to have a good lunch, or perhaps this is your lunch time and you have decided to spend your lunch time with us. We certainly appreciate it. We have wonderful information to share with you about an exciting opportunity for our community. My name is Jillian Bowers, and I am the program manager for the All of Us Research Program, as well as a proud participant of the All of Us Research Program. I'm very happy to be here with you this afternoon, even if it's a virtual platform. If the COVID-19 pandemic hasn't taught us anything else, it has certainly taught us how to stay connected while doing our part to keep us safe as well as others. Another important lesson that we've learned from the COVID-19 pandemic is that the scientific community working together can do some pretty amazing things. In the past, it has taken anywhere between 4 to 20 years to create a conventional or traditional vaccine. But for the new mRNA vaccines from Pfizer and Moderna, it was a record-setting 11 months. And this is remarkable. This process might have changed how we develop drugs forever. Being a resident of Mobile County and surrounding areas, you also have a unique opportunity to help shape the future of medicine by joining this wonderful program called the All of Us Research Program. How many of you have heard of the All of Us Research Program before today? If you've heard of the program, in the chat section of your mobile device or your laptop, if you would just enter the word yes, if you've heard of the All of Us Research Program before, or even if you know how, maybe you can use your raise your hand Zoom emoticon to let us know that you've heard about the All of Us Research Program. Great. From the responses, it looks like some of us have heard about the All of Us Research Program, which makes me feel good. If you have not heard about the All of Us Research Program, that just means that we have our work cut out for us today and over the next few months. The All of Us Research Program is part of a larger NIH initiative, and NIH is the National Institutes of Health. It's a part of a larger initiative called precision medicine. And precision medicine, if you don't know, is just a healthcare approach based on you as an individual. And it takes into account our differences, because our differences is what makes us unique. We look at things like where you live, what do you do for a living, your family health history, and your genetics, yes, your DNA. And the goal of the Precision Medicine Initiative is really to tell people what they can do to help them remain healthy. So the All of Us Research Program began enrolling participants in 2018 at the University of South Alabama. To date, we have enrolled a little over 1,300 people into our program within Mobile County and surrounding areas, and we're very proud about that. When COVID-19 hit, the program at a national level paused all in-person enrollments across the country. And we began heavily promoting online enrollment for almost a year. So we have recently relaunched all in-person activities here in Mobile County. We have 2 enrollment sites, the Strata Patient Care Center, which many of you might be familiar with, as well as our Stanton Road Clinic location. And we plan to open our 3rd enrollment site location next month at the Maston Internal Medicine Clinic. So Shamika Brown is our research navigator coordinator, and she is my coworker, and she oversees enrollment at each of our enrollment sites. And at the end of her presentation today, I am going to do my best to share a link in the chat. If you are interested in learning more about the program or joining the program, you can click on that link and share with us your contact information. And a member of our team will follow back up with you within the next few days to get you signed up with the program. We hope that you decide to join. We hope that you've come with questions today. We will bring answers for you. Please know that if you join this remarkable program, you will have an opportunity to contribute to how health and how medicine will change for many generations to come, while also learning about your own health. You'll get information back specific to your own health that you can take and share with your loved ones as well as your healthcare provider. We will also leave a few minutes at the very end to take your questions. I will monitor the chat, and Shamika and myself will both work together to answer those questions. So at this time, I am going to turn it over to Ms. Shemika Brown, who will tell you how you can become a change agent in our community and sign up for this wonderful program.
Okay, thank you so much, Jill. I appreciate the great introduction. Hi, everyone. Again, my name is Shamika, and like Jill said, I am the navigator coordinator for the All of Us research program here at South Alabama. Just want to say, thank you for allowing us to be here today to speak with you all and give you some information about our important research effort. We are going to play a video that's going to briefly introduce you to All of Us, which again is a biomedical research program that's available to the community that we serve here every single day. So we can go ahead and play that video. And Jill, if you would press play on the...
Okay, we're having technical difficulty with the video.
Oh, no.
We'll come back to that.
Okay, great.
But this video, if I can just jump in, it's a video that explains the All of Us research program. It is a nationwide effort. So we're not just talking about Mobile County, Baldwin County. It is across the United States, across the country. And the goal of the video says 1 million Americans. Mm-hmm. Very ambitious goal. It is one that we hope to achieve by the year of 2026. Our goal is to enroll at USA 1,000 individuals into the program each year. And this is people from all walks of life, hence the name of the program, All of Us Research Program. So it doesn't matter what illness you may be facing, what disease you may have, how healthy you are, what job you may do, it does not matter. The more diverse of a population that we have enrolled into the program, the more diverse of data that we're able to collect from our population. So there are no barriers to joining the program unless you're under the age of 19. So we have not started enrolling children yet, but we welcome people from all walks of life, and specifically those who have been traditionally underrepresented in medical research.
Absolutely. So moving on to our next slide, Dr. Errol Crook is the principal investigator of this project, and he serves as the director of USA's Center for Healthy Communities, and he is the professor and Abraham Mitchell Chair of Internal Medicine. And then we also have Dr. Alan Perkins, who is the co-principal investigator and serves as professor and chair of family medicine at USA Health. And I'm sure you all are familiar with both of these great gentlemen. So we are part of the Southern All of Us Network. USA Health began enrolling participants into the research program in 2018 and work alongside the medical institutions located in the southern region of our country. We have Louisiana, Mississippi, and of course us here in Alabama. To date, USA Health alone has enrolled more than 1,300 participants into our program. And like Jill said, we have an annual goal of enrolling 1 million people with a special focus on those who are have been traditionally underrepresented in biomedical research, or that UBR population, as we call it. And that population has been historically has not been invited to the table. Um, and those populations include those of race and ethnicity, age, sex, sexual and gender minorities, education, income related to the federal poverty level, geography, access to care, and disability. So all of us has partnered with various organizations, including healthcare provider organizations, sororities and fraternities on a national level, the Alzheimer's Association, American Diabetes Association, the Lupus Research Alliance, and many, many others. All of us community engagement partners serve diverse communities and help people join and remain in the program. So nationally, over 345,000 participants have joined all of us, and we hope that we have some more joining us today. So what is the All of Us Research Program? As Jill mentioned earlier, it is a program, it's a component based on a precision medicine initiative created in 2015 under the Obama administration. It's a long-term research endeavor funded by NIH, or the National Institutes of Health, and it aims to understand how a person's genetics, environment, and lifestyle can help determine the best approach to prevent or treat diseases. The goal of the All of Us Research Program is to help researchers understand more about why people get sick or why they stay healthy. The mission is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all of us. So if you do decide to join the program, you will be contributing to an effort to improve the health of generations to come. And then you can also learn more about your own health. And so the program will serve as the national resource for thousands of studies covering a wide variety of health conditions. So again, continuing with giving just some information about what All of Us is, just to let you know that participation is free and all activities are voluntary. You do not have to change healthcare providers to join the program. Your enrollment won't interfere with the way the participant receives their care from their current healthcare team. And then participants are asked just to periodically check in into their online portal that they create at the time of enrollment, and they will complete some surveys and just learn some information about what's going on in their portal. So why should you join All of Us? Again, you will be helping in your community. You will have access to um, your personal data. We don't just get your data and just run away with it and we never talk to you again. We want to make sure that you are a part of this process. So you have access to personal data as well as summarized data from across the All of Us research program. If you, as a participant, consent to receiving your genetic return of results, or your GROR, as we call it, you can opt to receive your ancestry, fund traits, pharmacological information, or information regarding risk levels of developing heart disease, cancer, and other health related information. Researchers can study DNA and other information from all of us participants to make discoveries. They could identify what makes people more or less likely to develop a disease, find out how environment, lifestyle, and genes can impact health, study if some DNA changes can tell how some people may be affected by certain medications as well. So the longer that you stay involved in the All of Us program, the more you learn about yourself, and you can help speed up the health research process and medical breakthroughs. You can also leave a legacy for your children, your grandchildren, and future generations by supporting the potential breakthroughs in areas such as cancer, diabetes, heart disease, dementia, depression, and also chronic pain. So, what makes us different from other programs that are out there? So, one of the things that we pride ourselves on is being participant centered. We invite participants to sit in on our governance and help decide which direction we should go in. Also, participate and brainstorm about the science and health conditions that matter to their communities, and they want to what they want to help do with this resource and help facilitate. We're committed to giving the information back to the participants. Like I said earlier, very few studies do this for reasons, because for one, it's hard, it's expensive, and it's challenging. But the All of Us research program is willing to do that because we believe that you deserve to get your information, your data that we capture about you. You deserve the information about your own health. Some other pieces of what makes us different: innovation. Very new things haven't been done on this large of a scale before. And then the accessibility as a program to researchers. We make the resources available to everyone. So when we open up the data and make it easy for lots of people to use, we hopefully accelerate the science and the breakthroughs that we all desperately are waiting for. So diversity in our program is really, really important. Diversity in a research program is important for several different reasons. Um, where we live, how we live, and our background can all affect our health. And we know that we don't all live in the same place. All of our backgrounds are different. Um, Secondly, many groups of people have been left out. That's those underrepresented individuals, and so they've been haven't been a part of research in the past, and so and trying to figure out why some of the people have been left out in the past and communities have not been a part of the research. Different reasons could be that they haven't been invited to take part in research, or they were invited but they were not told what was involved. And so most, if not all of us, are familiar with the history of medical research, especially in minority communities. The All of Us research program has learned from this history, and we want to make sure that we are doing things right. So many different groups of people can join the program. We tell you what we're doing, we share the results, and we protect your data. So just a little information about, tracking the diseases. Diseases like cancer, diabetes, infections, and diseases involving mental health, vision, and hearing will be explored in the All of Us research program. The data collected can help scientists tackle health disparities, spurring research and prevention that is customized and tailored to people in different communities. It may be based on where they live, on their race, or their ethnicity. A diverse cohort will enable researchers to explore, for instance, why Blacks have a higher mortality rate than whites from diseases like heart disease, type 2 diabetes, and hypertension. So all of us will notify participants of conditions that they may be at risk for. And this will allow the opportunity for a participant to notify his or her healthcare provider to make any necessary changes to their healthcare and healthcare plans. So privacy. So privacy is really, really big. Um, in everything that we do, we're always concerned about our privacy, whether it's through our bank, through our social media, through identity theft. So that's really important that your privacy in this program is protected. All of us is committed to making sure your data is kept private. We take great care to protect your privacy and your data. Some of the rules that we have to protect and some of the ways that we have to protect your privacy, we remove names and other identifying information from our participants' data before researchers can see it. And so by removing the names, we replace the names with a participant ID number. So they don't know who you are. They don't know any information, any of your personal information. You just have a participant ID number. Also, following all federal, state, and local laws and regulations for keeping information safe. We use strict internal policies and procedures to prevent misuse of your data. Experts regularly check our systems to make sure they're secure. Information is stored on protected computers. We limit and keep track of who can see it. Also, to work with your health data, researchers must agree to a number of rules. And one of those rules is promising they will not try to find out who you are. So all of us EHRs, which are electronic health records, and COVID-19. The All of Us research program is taking a very active role in our fight against COVID-19. All of Us has initiated scientific activities to help us better understand COVID-19 and inform current and future pandemic responses. This is being done through antibody testing of biosamples already collected and electronic health record integration. More than 200,000 All of Us participants so far have shared their information in their electronic health records. As it relates to the antibody testing, we'll be able to determine when and where the disease was in the country, as well as understanding infection rates in different communities. And this will help us understand how the disease spreads. If a participant receives healthcare at an All of Us affiliated healthcare provider organization, the provider organization sends the EHRs directly to our data repository center. And if a participant gets health care elsewhere, for instance, a local health department, we will provide easy ways to gather participants' EHRs in the future. And at that time, we notify the participant so they're able to decide whether to share their EHR or not. Researchers may be able to use the EHR information to understand patterns of symptoms, illnesses, treatment effects, and unravel why COVID-19 makes some people very ill and others not so much. We will use the blood samples to analyze genes, which play a role in health and diseases. When researchers can study EHR information from many people, they find the patterns, and the patterns help them understand, again, what keeps people healthy, what happens when people get sick, and why some drugs cause side effects. It can also lead to new ways to treat or prevent diseases. Without the electronic health records, these discoveries will be harder to make and take longer. Consenting to your EHR is completely optional, but we do encourage it for further research. So, what are we doing in our local office to um, keep everyone safe? We have certain protocols that we've put in place. We are taking great measures to ensure the safety of all of our participants during their in person visits. Some of the things that we do include COVID pre screening. We have pre screens 2 days prior to a participant's appointment. And then we also have a day of screening when the person comes to the enrollment center. If a participant is feeling ill when they reach their appointment date and they're at the enrollment center, we will reschedule, we'll cancel the appointment and reschedule them for a later date. We also have masks for our participants. If they do not have one, the masks are provided for them. If a participant refuses to wear a mask or a facial covering, the appointment will be rescheduled for a later time when the county is in a green status. We will thank them for their participation, of course, and just reschedule them for a later date. Another thing that we also do, we schedule a limited number of participants per day, and we schedule those appointments 1.5 hours apart to ensure that we have time to properly clean between appointments. So we clean everything. We clean all of our equipment, we clean the room, all the tools that we've used, anything that we've come in contact with, we take great measures to clean and sanitize those areas prior to our next appointment to come in. Consistent hand washing and sanitizing is all done before, during, and after the appointments. And so the most important part of this presentation, I know you guys have been dying to find out how you can join all of us. So there are a couple of ways that you can join our program. You can go to the website, which is joinallofus.org/USA, or you can pick up your phone and you can download the app. So once you download the app or you go to the website, you will create an account. You will give your primary consent to participate. You will agree to share your electronic health records. You will also complete or acknowledge the consent to get your DNA results. You will answer some initial health surveys. And then after that's done, we will contact you and we will make an appointment for you to come in and meet with us face to face to complete those physical measurements and those biospecimens with the blood donation and the urine sample. And then after doing all those things, completing those steps, you will receive a thank you and an incentive of $25. So just to know that you will need your valid photo ID, be able to communicate with us via text, phone call, in person, and email. So those are just the steps that we have to get started. In all of us, we make sure that we have project management. We check in on our participants on a regular basis, so we don't just sign you up and then just never check on you again. We want to make sure that you know that we are in with you for the long haul, and we hope that you will continue to be with us for the long haul. And so that's really the gist of our presentation today. If you have any questions, we will be more than happy to answer those questions. Follow us on social media, Facebook, Instagram, and Twitter. You see all of our handles there. Our phone number, if you need to contact us, is located on our screen. Our email addresses as well. And then, as Jill stated earlier, there will be a virtual lead card in the chat as we're answering questions. Feel free to fill that out. And so, Jill, I'm going to turn it back over to you for any last words on the presentation, maybe something I may have left out.
Thank you, Shamika, for a fabulous job sharing information about the All of Us research program. I hope that all of you all that attended you were able to hear something of interest to you that excited you to make you want to be a part of the program. I just want to add to a point that Ms. Shamika made with regards to the All of Us research program notifying you of any illness or disease that you may have. There are two diseases and or illnesses that we focus on at this time with the All of Us research program. As you might imagine, it will be very difficult and challenging to notify everyone who participates in the All of Us program of every disease and every illness that one may encounter or face. We will notify you of two types of diseases. The one is a cardiovascular disease because it can be fatal and or terminal, and the other is a cancer. So if you are found to have the genetic predisposition to either having heart disease or developing heart disease or having cancer or developing cancer, then the All of Us research program has partnered with a genetics resource counseling center called Colors. And Colors will notify you of the findings from your blood samples that you have shared with the All of Us research program. If you consent, because everything has to be done with your consent, if you consent to doing so, Colors will share with your healthcare provider, if you choose, the findings to help you digest and process the information that you're hearing to find out what can be done proactively or what could be done to prevent further progression of the illness or disease. So I thought that was an important point to make here with regards to illnesses and diseases. The other thing that I would like to clarify and make very clear to you is that if you would like to receive your genetic information back, and a lot of people join the program because they want access to their genetic return of information, which is a great thing. The All of Us research program returns genetic information over a period of time. So as I stated earlier, I am also a participant in the program. It took about 6 or 7 months before I received my genetic report back from the All of Us research program, and I had to consent to doing so. If you do not consent to receiving your genetic return of information, the All of Us research program will not share it with you. But it is totally voluntary and up to you whether or not you want to receive this information back. It takes time because research takes time, but you will get information back related to your ancestry information, as well as trait information, and finally, health information. So it's a wonderful opportunity for you to be empowered about your own health and really take charge and share this information within your family, because a lot of the same illnesses and diseases run through a family. So you can have this conversation, these critical conversations with other family members, and then take it to a healthcare provider to understand the implications behind having this such valuable information. And again, it is at no cost to you. It's just a little of your time. And we would like to keep you engaged over the length of the project. It is a 10-year program. We are now in year 3, soon to be in year 4. So we hope that if you join, we will keep you for an additional 6 years and possibly longer if the National Institutes of Health plans to extend the program. But we want you to remain engaged and committed throughout the longevity of the program. So at this time, I am going to stop sharing my screen, and I am going to allow you all to ask questions from the chat that both Shamika and I can answer. I am also going to go ahead and post the link for everyone to see. If you are interested in learning more about the program or joining the program, I just posted the link, the hyperlink. You may click on that and share your contact information and name, and our team will follow up with you. So I see a question from Miss India Washington. How has the All of Us program ensured diverse representation? Very good question, because diversity matters. Diversity is important. Again, this is a nationwide effort. So there are specific what we call UBR, underrepresented in biomedical research categories that we focus on. That looks at sexual orientation, it looks at gender, it looks at rural versus non-rural areas. We recruit from faith-based organizations, we recruit from various social and civic organizations within our communities to make sure that we're getting a diverse group of people that reflects the diversity of our country. Because we know that if we don't have diverse research or diverse data, then the data that we have really isn't for all of us. So we're very intentional, is the best word, India. We're very intentional about making sure that we're reaching those populations that have been historically underrepresented in biomedical research in our engagement efforts. Good question. Another question was, whom should one contact to join the program? You can do one of two things. Either you can go to the website, joinallofus.org/USA. Please select USA Health as your partner organization, so that way you will be linked, or paired is the right word. You will be paired to us, and we will know that we will need to schedule an appointment for you to come in to collect your urine and your blood sample. If you do not want to go to the online website, you also can download the Join All of Us mobile app on your mobile device. Doesn't matter if it's Android or Apple. You can download the app. You can create your username and password. Again, make sure you select USA Health as your partner provider organization, and we will follow up with you to schedule a time for you to come in to donate your blood and your urine sample. I will ask that you do one thing for me. Upon signing up for the All of Us research program, be sure to go ahead and complete the surveys that are available to you online. The surveys ask questions about your own medical health history, your family's medical health history, socio-demographic information as it pertains to where you live, where you work, where you play. Again, all of this information is self-reported data that is coupled with your electronic health record, as well as your blood and your urine sample, which is your DNA, your genetics, and it builds a big picture as to how healthy you may or may not be. And all of this information goes to Vanderbilt University, where there's a team of researchers and scientists that are analyzing this data and really building or creating the big picture, so to speak. So it helps to inform what's actually going on in Mobile, Alabama, and surrounding areas as it relates to health within different populations. And again, you have access to the findings as researchers and scientists learn more throughout the lifespan of this project. It's just a wonderful opportunity. I personally would love for everyone to sign up. I think the biggest barrier that we have faced within Mobile County is trust. People wanting to make sure that their information is protected, and rightfully so, and it's safeguarded. And I can assure you there are several measures in place to ensure that your data is private and that it's secure as it leaves our site and goes to the national level with Vanderbilt University and the National Institutes of Health. Are there any more questions that anyone may have? I think I've answered all of. There is another question. Would a study participant be able to obtain one's genomic data? Absolutely. 1,000 times yes. That's what's the most unique thing about this program. I've been a part myself of a couple of clinical trials in the past, and you don't have access to whether or not you're on the placebo, the fake drug, or the real drug. You don't have access to the findings. This is a research program, not a clinical trial, and that's what makes all of us different. Everything that a participant shares with the All of Us research program staff, that participant will have access to. Again, it takes time to get your genomic information back, but there will be whole genomic sequencing studies done on your DNA that you share. And if you choose to receive this information back, you will have access to this information. When will the studies be made to the when will the studies be made to the public? There is actually a researcher's workbench open now. We didn't go too much into that because of the audience that we're speaking to today, but there is a researchers hub space available online for you to actually access, the public can access to see what studies evolve or emerge from the All of Us research program. As health findings are found and highlighted across the country, this information will also be available on the Researchers Hub. So if you go to joinallofus.org, there's a little search magnifying glass. If you put Researchers Hub, it'll take you directly to the link so that you can have the public's view or the public's perspective of the studies that have since emerged since implementing All of Us in 2018. Is there a plan to enroll under 18 in the future? Yes, there is a plan to enroll those under the age of 18. As you can imagine, there's a lot of guidelines and there's a lot of research protocols that must be in place when we're talking about children. And so the simple answer to that question is yes. We hope to enroll children in the near future. COVID has COVID has definitely thrown a curveball in the timeline for doing that, but the plan is to enroll children in the future. Yes. There's another question. When will the studies be made available to the public? Again, the studies are available now. Public access is accessible. If you go to joinallofus.org and go and type in Researchers Workbench or Researchers Hub, you will see the findings to date. Of course, there will be many studies coming off of this larger All of Us research program. What they really hope is that scientists who want to start answering questions about dementia or answering questions about rare diseases like Fragile X or autism, that they can come to All of Us and identify a subset of population of individuals that have already donated their biospecimens with these illnesses and diseases and start testing different pharmacological drugs or things, or testing different treatments, or inviting these people to be a part of clinical trials to see how effective these drugs may be or these treatments may be. Excellent question. Are there any other questions for us? Seeing no new questions, I would like to thank you all for your participation today. Oh, I see one other question. Never too late. How do we keep in contact with members through the program? Great question. And I must say this. We can enroll 1 million people into this program. But if we don't keep in contact with them, if we don't retain them, essentially we've done absolutely nothing. So staying in contact is key to making sure that the data that we have is longitudinal data and is collected over a period of time. So we collect your name, your address, your telephone number. We collect proxy information. We also collect email information. If your telephone number changes, or if your address changes, we ask that you go into your online portal, because upon enrollment, everyone creates an online portal. We ask that you go into your online portal and you update your telephone number or your email address or your physical address as you move. So that way we can stay engaged with you and we don't have to call proxy or next of kin information to try to locate or find you. So that is a very good question. Thank you for asking that question. Retention is important. We are working very hard to make sure that we have actively retained the 1,300 people thus far that we have enrolled into the program. Great question. So at this time, I would like to thank everyone again for their participation in our social media Med School Cafe community forum. We hope and plan to be able to do this again. I hope to see you on the other side in the clinic very soon. Again, you can get the process started today just by going to the website, joinallofus.org/USA. You can also click on the link if you would like for our team to contact with you. If you have more questions, if you're still undecided, you have a question that you haven't thought about yet, we will be more than happy to follow up with you and get those questions answered. But again, we thank you for the opportunity. It's a wonderful opportunity to get the residents of Mobile County and surrounding areas engaged and involved to really help shape the future of medicine in years to come. Thank you and have a great rest of your afternoon.
Thank you.
Thank you, guys.